Welcome to your deep dive. Today, we're tackling a topic that's practically splashed across every health headline.
Mhm.
Type 2 diabetes. You've sent over like a treasure trove of articles and studies,
Mm.
and we're going to unearth the aha moments, the
Yeah,
surprising connections,
they are.
and equip you to navigate this complex landscape.
Yeah, it's true. There is an overwhelming amount of information out there, and
Right.
not all of it is accurate.
Right.
Our mission today is to sift through the noise and give you the clarity you need.
So let's roll up our sleeves and get to it. One thing that struck me while going through your research
Okay.
is how type 2 diabetes is often simplified to just too much sugar.
Right.
But it's so much more nuanced than that.
Right. Absolutely. It's a bit like an intricate puzzle
Yeah.
with multiple pieces contributing to the bigger picture.
Yeah.
While sugar does play a role, type 2 diabetes is fundamentally a metabolic disorder where your body struggles to use insulin effectively.
Okay.
Imagine insulin as a key
Mm.
that unlocks your cells, allowing glucose, the energy from the food you eat, to enter.
So when someone has type 2 diabetes, is it like their cells have changed the locks
Yes.
and the insulin key no longer fits?
What a fantastic way to put it. That's essentially what we call insulin resistant.
Okay.
It's like the key is there, but the lock is jammed, preventing the glucose from getting in.
Yeah.
And when that happens, glucose builds up in your bloodstream, which is where the real trouble begins.
And this is a completely different scenario than what's happening with type 1 diabetes,
Yes.
even though both involve blood sugar, correct?
Precisely.
Yeah.
In type 1 diabetes, the body's immune system mistakenly attacks the cells in the pancreas responsible for producing insulin.
Right.
It's like the key factory has shut down completely.
Oh, wow.
But with type 2 diabetes, you're still producing some insulin, at least initially. The problem lies in how your body responds to it, those stubborn locks refusing to budge.
That makes a lot of sense.
Yeah.
It's not about the absence of the key, but rather the inability to use it.
Right.
So, if insulin resistance is the root of the problem in type 2 diabetes, what causes it in the first place?
Right.
Is it predetermined by our genes, or are lifestyle choices the main culprit?
It's rarely one single factor, but a complex interplay of genetics and lifestyle. Think of it this way. Genetics might hand you a deck of cards, but the way you play them, your lifestyle choices, ultimately determines the outcome.
Okay, so let's break down those cards.
Okay.
You mentioned genetics plays a role.
Mm-hmm.
Does having a family history of type 2 diabetes mean you're destined to develop it?
Not necessarily, it's not a guaranteed sentence, but it does increase your risk. It's like inheriting a slight predisposition. However, and this is crucial, lifestyle choices hold significant power.
Right.
They can either amplify that predisposition or help keep it in check.
So if someone knows they have a family history of type 2 diabetes, should they be extra cautious about their lifestyle?
Absolutely.
Mm.
Being aware of that genetic predisposition empowers them to make proactive choices. Because while genetics might load the gun, to use a powerful metaphor, lifestyle pulls the trigger.
That's a powerful image for sure. And speaking of lifestyle,
Yeah.
I'm seeing that theme pop up constantly throughout this research. What are some of the biggest lifestyle factors that contribute to developing type 2 diabetes?
Let's start with obesity,
Mm-hmm.
especially excess weight around the abdomen. This is a major player in insulin resistance.
Yeah.
You see, fat cells, particularly those in the abdominal area, are like little hormone factories.
Okay.
They release substances that interfere with insulin's ability to function correctly.
So it's not just about the number on the scale,
Right.
but also where that weight is distributed.
Exactly. It's about understanding body composition and the impact of those hormonal messengers. And speaking of messengers, did you know that inflammation,
Right.
often triggered by an unhealthy diet, also plays a role in disrupting insulin signaling?
It's like a domino effect.
Yeah.
One thing throws off the balance, leading to another. We know what we eat plays a big part, but what about physical activity?
Right.
How does that fit into this puzzle?
Physical activity is crucial. When we move our bodies, especially in ways that challenge our muscles, it's like giving those insulin receptors a wake-up call.
Yeah.
Exercise improves insulin sensitivity, making your cells more responsive to insulin's message.
So moving our bodies regularly is like fine-tuning our insulin's communication system.
Precisely. On the flip side, a sedentary lifestyle is a recipe for insulin resistance.
Mm-hmm.
When we spend hours sitting, our muscles don't get the memo to use glucose effectively.
It's like our bodies were designed for movement, and when we don't move enough,
Yes.
those intricate mechanisms start to falter.
Exactly. And we can't forget about the food we fuel our bodies with.
Right.
While it's not about demonizing any specific food group,
Mm-hmm.
certain dietary patterns can significantly impact insulin resistance.
This is where the conversation about sugar often comes into play. But from what I'm gathering, it's not just about sugar itself, but rather the company it keeps in our diet.
That's a great way to put it.
Okay.
It's more about the overall dietary picture. Diets high in processed foods, sugary drinks, and refined carbohydrates. They all contribute to those dreaded blood sugar spikes, which, over time, can lead to insulin resistance.
So it's less about banishing sugar entirely
Right.
and more about choosing foods that support stable blood sugar levels.
Exactly. Think of it this way. Instead of reaching for that sugary soda, opt for a refreshing glass of water with a squeeze of lemon. Or, instead of that processed snack bar, choose a handful of almonds or a piece of fruit.
Small, sustainable swaps can make a
Yes.
big difference in the long run.
Exactly.
We've talked about the underlying causes of type 2 diabetes, but let's switch gears and talk about the symptoms. How does someone know they might be developing this condition? Is it usually obvious?
That's a critical question because type 2 diabetes can be sneaky. Unlike type 1, which often presents with more rapid and noticeable symptoms, type 2 tends to develop gradually, with subtle signs that can easily be brushed off.
So what are some of those early whispers that we shouldn't ignore?
One of the most common early signs is increased thirst. When blood sugar levels are high, your kidneys go into overdrive trying to flush out the excess glucose, leading to dehydration and that persistent thirst.
It's like your body is sending you a signal like, hey, something's off here.
Exactly.
What other signs should we be paying attention to?
Another telltale sign is frequent urination, especially during the night. Essentially, your body is trying to get rid of that excess glucose through your urine.
I've also read about unexplained weight loss being a potential symptom.
Mm-hmm.
That seems counterintuitive
Yeah.
since we often associate type 2 diabetes with weight gain.
Right.
Can you shed some light on that?
It's a bit paradoxical, isn't it? But it goes back to how your body utilizes glucose for energy. When your cells can't access glucose effectively, they start looking for alternative fuel sources like fat and muscle.
Okay.
This can lead to weight loss, even if your eating habits haven't changed.
That's fascinating.
Yeah.
So if someone is experiencing unexplained weight loss,
Mm-hmm.
especially alongside increased thirst and frequent urination, it's definitely worth getting checked out.
Absolutely. And those are just a few of the more common symptoms.
Right.
There are other, perhaps less obvious signs that people might not immediately associate with type 2 diabetes.
That's what makes this deep dive so crucial, uncovering those hidden connections.
Yes.
So what are some of those less obvious signs?
Okay.
What else should we have on our radar?
Well, for instance, have you ever noticed how sometimes when you're exhausted, it feels like you can't think straight?
Yeah,
That feeling of brain fog, that mental fatigue,
great.
can be an early sign of fluctuating blood sugar levels. It's like your brain isn't getting the fuel it needs to operate at full capacity.
Wow, I would have never connected those dots.
Yeah.
It's easy to just write off brain fog as a side effect of a busy life, but it's a good reminder to pay attention to our bodies
Yes.
and those subtle cues.
Exactly. Our bodies are constantly communicating with us.
Yeah.
It's just a matter of learning to listen. Another subtle sign that often gets overlooked, especially in our digital age,
Right.
is blurred vision.
I can see how that might happen. You think you just need a stronger prescription for your reading glasses. What's the connection between blurred vision and blood sugar?
High blood sugar, over time, can damage the tiny blood vessels in your retina, the back of your eye responsible for processing light.
Hmm.
It's like putting stress on the delicate wiring of your visual system.
That makes my eyes water just thinking about it.
Right.
So blurred vision, even if it seems temporary, should never be ignored, especially if other symptoms are present.
Precisely. And it highlights the importance of regular eye exams, particularly for those with a family history of type 2 diabetes
Right.
or who are experiencing other symptoms.
Yeah.
Early detection is key.
Speaking of early detection, are there other unexpected signs, maybe things people wouldn't necessarily think are related to blood sugar?
Absolutely. One that often surprises people is slow wound healing
Okay.
or an increased susceptibility to infections.
Really? I've definitely experienced those things, but I just attributed it to life happening. How does type 2 diabetes play a role?
When blood sugar is consistently elevated, it can interfere with your body's natural healing process. It's like having a kink in the supply line that delivers vital nutrients and oxygen to the site of an injury. slowing down the repair work.
So it's not just about the injury itself, but
Yeah.
also how effectively your body can respond and recover.
Precisely. And that same high blood sugar environment can also suppress your immune system,
Oh, wow.
making it harder for your body to fight off those opportunistic infections that are always lurking about.
So something as simple as a cut taking longer to heal than usual
Mm-hmm.
could be a subtle signal from your body that something's amiss with your blood sugar.
It's definitely a possibility worth exploring with your doctor.
Okay.
And let's not forget about another surprising symptom that often leaves people puzzled. Tingling or numbness in the extremities, especially the hands and feet.
Yes. I remember seeing this in the research. It's called neuropathy, right?
Yes.
Can you explain what's actually happening in the body when someone experiences this?
Essentially, high blood sugar can damage the nerves in your body, particularly those long nerves that extend to your fingers and toes. It's like fraying the delicate wires that transmit signals between your brain and your extremities.
And those frayed wires lead to those uncomfortable sensations of tingling, numbness, or even pain.
Exactly. And unfortunately, if left unaddressed, neuropathy can progress and affect other parts of the body,
Right.
leading to more widespread nerve damage.
So neuropathy isn't just a minor inconvenience. It's a red flag that uncontrolled blood sugar is causing real damage to your nervous system.
Exactly. And it highlights why managing type 2 diabetes is so important,
Right.
not just for today's well-being, but for safeguarding your health in the years to come.
And speaking of safeguarding your health, let's talk about the potential long-term complications of unmanaged type 2 diabetes. This is where it really hits home why understanding this condition and taking proactive steps is crucial.
Absolutely. It's easy to get caught up in the day-to-day, but it's vital to remember that high blood sugar, if left unchecked over time, can have a ripple effect throughout your entire body.
So let's dive into those ripples. One of the most concerning complications I came across in the research was cardiovascular disease.
Mhm.
Can you break down what that actually means for someone with type 2 diabetes?
Of course. We often think of our circulatory system as a network of pipelines,
Mm.
and in many ways it is.
Right.
But high blood sugar over time can damage those delicate pipelines, making them less efficient.
It's like those sugary deposits are slowly clogging up the plumbing of your body.
That's a great way to visualize it.
Okay.
And just like a clogged pipe, those damaged blood vessels can lead to all sorts of problems,
Right.
from high blood pressure to an increased risk of heart attack or stroke.
That's incredibly sobering.
Yeah.
So managing blood sugar isn't just about preventing those immediate symptoms we discussed earlier.
Right.
It's about protecting your heart and circulatory system in the long run.
Exactly.
Yeah.
And the heart isn't the only organ at risk.
Okay.
Uncontrolled type 2 diabetes can also lead to kidney damage,
Right.
known as nephropathy.
Not the kidneys, too. What's happening there?
Your kidneys are incredible filtration systems, working tirelessly to cleanse your blood of waste products.
Hmm.
But high blood sugar puts extra stress on those delicate filters.
It's like overworking those filters until they start to wear down.
Precisely.
Yeah.
And when those filters are damaged, it compromises your kidney's ability to do their job effectively, which can lead to a buildup of toxins in your bloodstream and even kidney failure in severe cases.
That's heavy stuff.
It is.
It really drives home the point that type 2 diabetes isn't just a blood sugar problem.
Right.
It has the potential to impact your entire body.
Absolutely. And we're not done yet.
Oh, no.
We've talked about the eyes before, but it's worth revisiting because eye health is so crucial, and uncontrolled type 2 diabetes can have devastating effects on your vision.
I'm all ears because this is something I personally worry about.
It's understandable. Remember those tiny blood vessels in the retina we discussed earlier?
Yes.
Well, high blood sugar can damage those vessels, leading to a condition called diabetic retinopathy. It's a leading cause of vision loss among adults.
This is what makes managing this condition feel so urgent.
Yes.
The potential for irreversible damage.
It is, and it's not just about vision loss.
Right.
Uncontrolled type 2 diabetes can also increase the risk of other eye problems,
Right.
like cataracts and glaucoma.
Okay, I'm getting the message loud and clear. Taking care of my eyes is non-negotiable.
Absolutely. And it's not just about your eyes. It might surprise you to learn that type 2 diabetes can even impact your feet.
My feet. What's the connection there? It seems so unrelated.
I know, it sounds strange at first.
Yeah.
But think back to what we were discussing earlier about nerve damage and poor circulation.
Right.
Those two factors combined can spell trouble for your feet.
I'm starting to see where this is going.
Yeah,
Those compromised nerves mean you might not feel pain or discomfort as easily.
exactly. You might have a cut, a blister, or even an infection developing in your foot.
Right.
But because of the nerve damage, you might not feel it until it's become more serious.
And if you add in poor circulation, which is also a common complication of type 2 diabetes,
Yes.
it becomes even harder for those wounds to heal properly.
Precisely. It creates a perfect storm for those seemingly minor foot issues to escalate into something more serious, potentially even leading to infections that are difficult to treat.
Wow, I had no idea the impact of type 2 diabetes could be so far-reaching. It really underscores the importance of a holistic approach to managing this condition.
I couldn't agree more. It's about understanding the interconnectedness of your body and how crucial it is to prioritize your health from your head to your toes.
So we've covered a lot of ground here,
We have.
and it's been a bit of a roller coaster ride. We've explored the complexities of type 2 diabetes, from its underlying causes to those often overlooked symptoms, and the potentially serious long-term complications.
It's a lot to digest, for sure.
Right.
But remember, knowledge is power.
Yes.
And armed with this knowledge, you're in a much better position to advocate for your own health or the health of someone you care about.
That's what makes these deep dives so worthwhile.
Yes.
But we're not quite done yet.
Right.
We've talked about the challenges, but now let's explore the solutions. What can people actually do to manage type 2 diabetes and prevent those complications we've been discussing?
Right.
Because I have a feeling it's not all doom and gloom.
You're absolutely right. Well, type 2 diabetes is a serious condition. It's not a hopeless one. There's so much you can do to take charge of your health. And that's what we'll delve into after a quick message from our sponsors.
And we're back, ready to transform that knowledge we've gathered into action. Before the break, we were teetering on the edge of hope.
Yes.
So let's dive right into the empowering part. What can someone do to take control of their health after a type 2 diabetes diagnosis?
It's like being handed a map after feeling lost in the woods. A type 2 diabetes diagnosis isn't a dead end. It's a call to become the CEO of your own health journey.
I love that.
And the good news is you don't have to navigate this alone.
That's music to my ears because I'm all about empowering listeners with tools and knowledge. So where do we even begin? What's the compass that guides us toward effective management of type 2 diabetes?
While medication can be a valuable tool, it's not always the first line of defense. The cornerstone of managing type 2 diabetes and honestly living a vibrant life is lifestyle modification.
Right. It all circles back to those lifestyle factors we discussed earlier.
Exactly.
The food we eat, how much we move, even how we manage stress.
Exactly. By addressing these areas, you're essentially taking back the reins and influencing those very pathways that contribute to type 2 diabetes.
Okay.
It's about making sustainable changes that nourish your body from the inside out.
I love the sound of that. So let's break it down.
Okay.
Diet is always a hot topic. What are some of the most impactful dietary changes someone can make?
Imagine your plate as a canvas for creating a blood sugar balancing masterpiece.
Okay.
It's about ditching the restrictive diet mindset and embracing a way of eating that supports stable blood sugar levels.
So no crash diets or deprivation, just smart choices that fuel your body well.
You got it. One powerful strategy is to focus on foods that have a low glycemic index, meaning they break down slowly and prevent those dramatic spikes in blood sugar.
Okay.
Think whole grains instead of refined grains, an abundance of colorful vegetables, lean protein sources, and those heart-healthy fats.
It's like swapping out that sugary breakfast cereal for a bowl of steel-cut oats topped with berries and nuts.
Yes.
A blood sugar balancing breakfast of champions.
Now you're getting it. And don't forget about portion control.
Right.
Even healthy foods, if eaten in excessive amounts, can disrupt blood sugar balance. It's all about finding that sweet spot for your body.
Right. It's not about restriction. It's about being mindful and choosing foods that support your well-being. Speaking of well-being, what about exercise? What kind of movement is most beneficial for someone with type 2 diabetes?
I have good news. You don't need to become a marathon runner overnight.
Okay, good.
The key is to find activities you genuinely enjoy and make them a regular part of your routine.
Right.
Remember, any movement is better than none.
So even small bursts of activity throughout the day can make a difference, like taking the stairs instead of the elevator or parking further away from the store.
Absolutely. Think of it as weaving movement into your everyday life. And when it comes to more structured exercise, aim for at least 30 minutes of moderate intensity exercise most days of the week.
And moderate intensity doesn't have to mean intense gym sessions, right? It could be a brisk walk with your dog, a dance class, even gardening.
You got it. It's about finding what works for you and your body and making it a sustainable part of your life.
Right, and I
Huh.
imagine, and don't forget about weight management. I
Yes.
remember reading that even losing a small amount of weight can significantly impact blood sugar control.
Absolutely. Even a modest weight loss of 5–10% of your body weight
Hmm.
can make a remarkable difference in improving insulin sensitivity and reducing the risk of those long-term complications we discussed.
Yeah.
It's like giving your pancreas a much-needed break.
I love that analogy.
Yeah,
So we've got diet, exercise, weight management.
right.
Those are three powerful pillars for taking control of type 2 diabetes.
They are.
But sometimes lifestyle changes alone aren't enough,
Right.
and medication becomes part of the equation, right?
You're right. In some cases, medication is necessary to help manage blood sugar levels effectively. The good news is there have been incredible advancements in diabetes medications.
Oh, good.
It's no longer a one-size-fits-all approach.
So what are some of the different types of medications available, and how do they work their magic?
Well, one commonly prescribed medication is metformin.
Oh, okay.
It acts like a key organizer, helping your body's own insulin work more effectively.
Okay.
Then there are sulfonylureas, which give your pancreas a little nudge to produce more insulin.
It's like having a whole team of helpers to support healthy blood sugar regulation. Are there other medications that work in different ways?
Absolutely. DPP-4 inhibitors work by boosting the power of natural gut hormones that regulate blood sugar. Then there are SGLT2 inhibitors, which act like tiny bouncers in your kidneys, gently escorting excess glucose out through your urine.
So many different approaches. It sounds like finding the right medication or combination of medications is a very personalized process.
You hit the nail on the head. It's not a one-size-fits-all situation. The best approach depends on various factors, such as the progression of your type 2 diabetes, other health conditions, your lifestyle, and even your personal preferences.
So open communication and a strong partnership with your doctor are essential.
Absolutely. Regular checkups and honest conversations with your healthcare provider are crucial for staying on top of your type 2 diabetes management and ensuring you're getting the most tailored care possible.
Now, before we wrap up our deep dive into type 2 diabetes,
Okay.
I want to circle back to something we touched on earlier, the difference between type 1 and type 2 diabetes.
Right.
They're often confused,
Yeah,
and understanding the distinction is important.
absolutely. While both types involve challenges with blood sugar regulation, their root causes are fundamentally different.
Right.
Imagine your body as a finely tuned orchestra in type 1 diabetes. The immune system mistakenly attacks the pancreas, the instrument responsible for producing insulin. It's like silencing a key instrument, leading to a complete absence of insulin production.
And that's why people with type 1 diabetes require insulin injections or an insulin pump to stay alive to essentially replace that missing insulin.
Exactly. Now, in type 2 diabetes, the pancreas is still playing, but the message isn't getting through clearly.
Right.
It's like the other instruments are having trouble hearing and responding to the insulin signals, leading to insulin resistance.
That's such a helpful analogy.
Yeah.
So both types of diabetes require lifelong management,
Yes.
but with very different approaches.
That's right. Both type 1 and type 2 diabetes require ongoing attention to blood sugar control, healthy lifestyle choices, and often medication.
As we resurface from this deep dive into the world of type 2 diabetes, it's clear this is a multifaceted condition, but it's definitely not an insurmountable one. Knowledge truly is power.
It absolutely is. By understanding the causes, recognizing the symptoms, and embracing those empowering lifestyle changes, you can significantly reduce your risk of developing type 2 diabetes. And if you're already living with this condition, you can manage it effectively and live a long, fulfilling life.
This deep dive was just the beginning. We encourage you to keep exploring, keep learning, and keep those questions coming. And remember, your health is a journey, not a destination. Take it one step at a time and never underestimate the power of small changes to make a big difference. Until next time, stay curious.